Hi, I am Dr. Arvind from Chennaiplasticsurgery. Today we will see about facelift. Aging face is a mandatory phenomenon. Aging occurs because of the changes in the skin, looseness occurring due to loss of collagen, looseness occurring due to the changes in muscle and the loss of the normal inherent fat of the face. Though it can be delayed, it can never be avoided, and in populations with thinner skin, the problem becomes evident at the age of around 50. Changes that take place include appearances of lines, changes in the contour around the malar region, droopiness along the sides of the face, double chins, and prominent lines such as the laughing lines, the bunny lines on the nose, and the droopy lips. Correction of the problems will involve addressing the problem in the different areas of the faces, which can be divided into the upper face, which includes the eyebrows, foreheads, and the eyelashes and the upper eyelid. The middle face, which will involve the whole of the eye, which is the upper eyelid and the lower eyelid, the region around the cheek, around the nose, around the mouth and the chin, and the neck, which usually involves the anterior aspect of the neck up to the sternum. And the mid and the lower faces, that is the neck, are usually addressed together by a surgical procedure which is commonly referred to as the facelift. Facelift is a surgery that involves tightening of the skin, tightening of the underlying supporting system of muscles and fascia that support the skin in such a way that the wrinkles and the furrows are removed, the fat that is present within the skin and the muscles are repositioned to their proper places, so that the patient ultimately gets a look that makes him appear young and fresh. The process before facelift involves a thorough consultation with the patient to understand what are the problems that are very prominent to her or him, and understanding what can be done for them, and making the person and the client understand what can be done by the procedure. A clear idea about the present physical status, whether they are smokers, is taken. A person who smokes is not an ideal candidate for a facelift because there is always some healing abnormalities in the wound. So a person who smokes must at least take a break of 2 months before he decides on a facelift. Further consultations proceed with identifying the areas which have to be corrected and marking the procedure incision lines which are done in front in the theatre. After that, the patient is taken for the surgery. The surgery is done under general anesthesia, where an incision around the ears is made. The plane underneath the skin which holds the skin in place is identified and it is tightened. The excess skin is removed and the surgery gets over at around 3 to 4 hours. When the surgery is over, the patient wakes up with a bandage that surrounds his face and his neck. At the end of 2 days, the plasters are removed. The patient will have a little bit of redness on his face, a little bit of swelling in his face, which will all subside by 10 to 15 days. There is a little bit of redness along the scar line, which persists for at least 15 days to 20 days, and after that the person is left behind with a thin imperceptible line that is not easily noticeable. After facelift, the patient is supposed to take care of himself by following a few simple rules. He is supposed to sleep with his head elevated. He or she must not massage his face for a few days, which extends up to 2 to 3 weeks. Must have regular ice packs applied on his eyes and on the face to keep the swelling down. He can take a soft diet from day 2 and can get back to his normal diet by his 5th day. There will be a little tightness of the face which will go after a few weeks, after which a little massaging would help to create a good free skin on the face. There will be a little tightness of the face which the patient will experience for the first 2 weeks after surgery. This tightness will go away along with time, and it can be hastened with a little massage that can be started after 2 weeks. Thank you.